Hello friends, today we will discuss CT CABG, coronary artery bypass graft. First of all, we have different protocol, coronary calcium score or CT CABG. This is a CABG case. We will select the CT CABG protocol. Now, as you can see, this is ECG gated scan. So we will apply ECG leads. I have already made a video on ECG leads placement. If you still have any confusion, let me know in the comments. In post CABG patient, the heart rate should ideally around 60. Now contrast injector setting. Flow rate 5.5 ml, contrast volume 85, NS 40 ml. So friends, now our scan is ready. Before starting, we can also change the language setting if the option is available in our system. We have already added multiple languages, so you can also configure your local language accordingly. After adding the language, we need drag and drop commands into the required section, means topogram, plane, calcium scoring and angiography scan. And with this setup is complete. Now next we will confirm the topogram. So this is our topogram image. In CT CABG, you must ensure proper coverage from the subclavian artery level up to and the end of heart. There is the ECG leads were slightly displaced superiorly, so I pause the scan, reposition the ECG leads and repeat the topogram. I was explaining the scan range should start 1 to 2 slices above the origin of the subclavian artery and end of heart. After proper planning, we proceed further. After repeat topogram, now the plane scan will be occurred which use the calcium scoring. Heart rate approximately around 60. Now we have start the plane scan, and as you can see, this is acquisition and here the scan end. Friends, if you want to spare video on how to reduce heartbeat, and know in the comments and will explain in the details. Next, we will perform pre-monitoring, similar what to do coronary angiography. That means we will set to the ROI approximately 2 centimeter above the starting point, means LM. LM approximately 2 centimeter according the LM. Now we have completed the pre-monitoring, which means placing the ROI approximately 2 centimeter above the left main coronary artery. Let me repeat, pre-monitoring should be done 2 centimeter above the left main artery. Here we can see the descending aorta and we will perform bolus monitoring at this level. Next, we need to perform angiography planning. The scan should start from the graft origin you must first confirm whether the graft is LIMA and RIMA. The should be verified on the plain scan. In this case, we have only a LIMA graft, not RIMA. So for LIMA, we plan the scan from subclavian artery up to the end of heart. Ensure that the scan contract properly, scroll through the image, verify the coverage. Now copy parameters carefully to scan cutoff. Adjust parameters slightly if needed then. Now copy recon volume parameter from the starting phase and then paste second phase recon volume parameter and repeat for the third phase. So first copy recon volume parameter and paste recon volume parameter. Now the CABG plan is complete. Before the starting in scan, instruct the patient properly breath hold. Now we proceed the scan. Flow rate, contrast and normal line. Here we are started both the injector and CT scanner machine. As you can see, the scan bring when the in the descending aorta reach the threshold 120. Now the scan is started and as you can see we have obtained the excellently quality scan perfectly timed. Friends, if you want a spirited video on post CABG technique and details CABG anatomy, please comment and I will provide that as well. Thank you.